Carpal tunnel syndrome occurs when swelling within a tightly enclosed area of the wrist, known as the carpal tunnel, puts pressure on the median nerve that passes through it. Over time, this can cause progressive numbness, tingling, and weakness where the median nerve sends its branches to the palm and fingers of the affected hand. A tough band of tissue, called the transverse carpal ligament, stretches across the wrist, forming the roof of the carpal tunnel. A carpal tunnel release is a surgical procedure in which this band is cut, releasing pressure on the nerve and relieving the symptoms of carpal tunnel syndrome. There are two ways to perform the surgery. In the traditional open procedure, your surgeon will begin by making a single 3 to 5 inch incision in the palm and wrist. He or she will then dissect through the underlying tissues to reach the transverse carpal ligament and cut it. The incision is closed with stitches, and hand use is not regained for several months. Although the carpal ligament is cut, substantial damage to surrounding tissues is inevitable given the nature of the procedure. The new AccuCision procedure requires only 2 tiny keyhole incisions, neither larger than 7 millimeters, rather than a single large incision. It is designed to produce a shorter and less painful recovery period. The procedure begins when your surgeon uses an instrument called a cannula to make 2 ports in your palm and wrist. Your surgeon will then insert a fiber optic device into the wrist port. Images from its camera are magnified and projected onto a video monitor in the operating room. Using instruments passed through the other port, your surgeon will release the transverse carpal ligament. When the procedure is completed, bandages are used to cover and heal the ports. AccuCision is a stitchless procedure. The hand can regain unrestricted use within 1 week after the procedure. Renova Hand Centers are proud to be the exclusive providers of the AccuCision procedure. Get back to life faster.